So Bernie, you're here today for your second amniotic injection.
Correct.
And you and I, we both agree that you had a very interesting case because you decided to inject just one foot, and then you're here today, 4 weeks after, for the injection in the opposite foot.
I am.
So I'm going to let you tell me what kind of symptoms you had before you came in to see me, and and why we decided to do the amniotic injection.
Okay.
Okay?
I had severe pain. It would start at my toes and go up the top of my foot and up the side of my leg, and it would last like a terrible cramp, and it would last maybe 5 minutes, and I could barely stand the pain. I had to walk around as long as I could, and my toes would literally curl back on me.
Okay.
And that hurt terribly too.
How long have you had it for?
Probably a year.
A year.
But it's been getting worse. Yeah,
Okay.
definitely getting worse.
So we have tried everything, all the alternatives, and we did all the testings.
Yes.
And we decided that amniotic injection is the way to go, and you've done your homework, you've done your research. So you had your right leg injected.
Yes.
And tell me the symptoms, were they gone within a week, 2 weeks? How long did it take for the...
It started about 2 weeks. I started noticing more and more of a difference. And continuing to get better and better and better all the time.
And that's why you scheduled the left one for today, and we just did it.
It was supposed to be Monday, and I moved it up to today.
Good for you.
Because I was anxious to get it done, because definitely a big difference.
So for people who live with nerve pain, tendon pain, would you recommend this?
Oh, absolutely.
As alternative to...
Absolutely. I've already mentioned it to some people.
Yes, absolutely.
Absolutely.
And what I liked about your situation is you did your research before. So, you came here as a very educated patient, very educated consumer.
Thank you.
Good for you, I really love patients like this, because I love when you do your own due diligence and then you tell me what you want.
That's great.
All right, well, thank you.